The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Thank you for being here. We're here to produce the next episode of TMD Demystified, and my name is Tony Urbanek. The topic for today, the title for today's episode is Less is Better When Treating TMD. Less is better when treating TMD. Let me explain. TMD, or temporomandibular joint disorder, better known as TMJ, temporomandibular joint, is actually a conundrum wrapped in an enigma within a mystery. That is the way it's worked out for 70 years. And I don't think that you would find too many dentists and or physicians and or patients who would disagree with that. And I'm going to try to explain a little bit today why that is, why that happened to be, and why it shouldn't be, and that actually less is better when trying to treat TMD. Until recently, the gold standard in treating TMD was, or understanding, let's say the gold standard in understanding TMD was a seminal article written by a Dr. Daniel Laskin, who was an oral and maxillofacial surgeon, and I'm very familiar with him, recently passed, who was a good doctor, a good man, but he wrote an article in 1969, which was published in the July 1969 Journal of the American Dental Association, entitled Etiology of the Pain Dysfunction Syndrome. And in that, he gave his theory as to why there were 5 reasons why he was able to delineate, define the thing that we discuss now as the TMD problem in 5 different ways, supporting the fact of the pain dysfunction syndrome. It is now called generally the myofascial, not facial, myofascial pain dysfunction syndrome. Basically, a syndrome being many symptoms associated with a single disease, syndrome. A single name describing it, and then because there's so many different descriptions and symptoms, then they label it a syndrome. So he wrote this article in 1969, and clearly in the article stated that this was his opinion and that this was a theory he had come up with. Somehow, I cannot explain this. The dental profession has taken his article of 1969 and brought it to the forefront and considered it fact based on what he wrote and what is now considered the myofascial pain dysfunction syndrome, originated by Dr. Danny Laskin in 1969. So, I mean, I can have an opinion, and my opinion is not very, does not put dentistry in a good light. And so I'd rather not go there too far, but it is my contention that the study of this problem within dentistry has not been done adequately, completely. It has been abused, generally speaking, with a dentist who have a particular bias in one area or another, their dental bias, that because the joint itself, there's two of them, one right on each side, because the temporomandibular joints are connected to the lower jaw mandible, and the mandible has 32 teeth in it, that it must be a dental problem. And so with the bias blinders on, whatever area of dentistry they're working in, they apply that area to the solution of the problem. That certainly was my example, my experience, and that I can speak on with authority because for 36 years I attempted to treat this problem, TMD, surgically, and I had surgical bias on, blinders, thinking that well, it must be a surgical problem because my compatriot surgeon said it was. And although I was taught critical thinking in my training in different areas, I really didn't apply it enough to try to solve this problem. Critical thinking is taking a piece of data or an article or what someone says and critically see whether or not it holds water, whether or not it is factual, whether or not you can prove what you're saying from the facts that you are saying. But and all the different dental specialists or dentists, because they had bias in their particular area, orthodontic bias, general dental bias, their bias as to, well, I can straighten teeth, so the solution should be to somehow straighten the teeth in such and such way will make your TMJ pain go away. And I can quote to this very day many orthodontists who claim that by straightening teeth, they can make the TMD symptoms go away, which is not true, mainly because they don't understand exactly what's causing these symptoms. In any case, that was strike one against the dental profession as trying to solve the problem. They did not take Dr. Laskin's article at face value as written, that it was a theory, and they brought it into the limelight as fact. The second biggest mistake, which I've spoken on before, but I'm pulling all the information together here in this one episode, was that the dental schools across the board, I mean, I think roughly there are around 100 dental schools in the United States of America right now, never ran into a dentist who disagrees with me on this topic, on this statement, that all dental schools teach that the treatment of TMD is very complicated because the joint is very complicated. It's a very unique joint. It's not like any other joint in the body. It is so different that no one's going to figure it out. It's not like any other joint in the body, which frankly is a big lie. It is true from the standpoint of me being an anatomist and cell biologist, looking at the whole area of joints within the body. Physiologically, all joints operate under the same physiologic mechanisms. Now, they may look a little different. The knee does not look like the elbow, and the temporomandibular joint does not look like the shoulder. But they operate under the same physiologic conditions. So the dental schools taught that this joint is unique, and actually, because they promoted it being so different, so unique, it's extremely hard, if not impossible, to figure out. That was their justification for not offering a predictable, successful solution. Because remember, it is a conundrum wrapped in an enigma, and both the physician profession and the dental profession, and of course, millions of primarily females who have TMD symptoms agree it's a conundrum. So that was the dental profession's excuse for, it's so complicated, it's so different that we just don't know. And then they go on. And then the third strike against the dental profession was considering that they really only focused on trying to treat symptoms. And there are many symptoms, and I've talked on many times, but I'll repeat them again. I have them listed out in my mind really clearly. The symptoms of TMD, and these are not the only ones, but these are the most prominent one that no one would disagree with. No one who is treating or ever treated a TMD patient would disagree with the list of symptoms I'm about to give you. So the symptoms of TMD are frequent and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in your ears, like your ears full of water, can't hear, vertigo, dizziness, that's vertigo / dizziness. There's a distinction between the two, but very similar. Upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the symptoms, and they're very disparate symptoms. They're the symptoms that the syndrome is based on. And because everyone's bias, dental bias, they're looking at a symptom and just trying to solve the symptom without looking at the cause. Because if you have a disease that has disparate symptoms, there must be some common denominator. There must be some common denominator that causes all those symptoms. And frankly, that's what I discovered. I discovered the common denominator that literally creates the symptoms. And then once you know what the common denominator is, then it's much more feasible to attack or do investigations on trying to figure out how to make that common denominator go away or better. But the dental profession wasn't even looking for the common denominator. They were just looking at a symptom. If your symptom is pain right here every morning, they just go out and working on a way to figure out how to treat that symptom, pain right there, whether it be through medication or through physical therapy, or the big lie that someone can teach you how not to clench and grind your teeth, which we don't even understand the mechanism for clenching or grinding, let alone how to get someone to stop. But that's just one example. Another example I talked on recently was botulinum toxin A, or Botox, which is botulinum toxin A is the generic. But everybody knows botulinum toxin A, not as that, but as Botox. It's almost the generic name because their advertising has been so good. But botulinum toxin A, all it does is paralyze muscle. I think I spoke recently on an extremely good article but if you use a placebo or Botox, they all have the same effect of decreasing pain in a muscle. So draw your own conclusions about that. Botox used for TMD is off-label. It's not approved by the FDA to use for TMD. It's off-label. And I have my opinion about anyone who is using Botox. The very best I can give them is they haven't thought the whole thing through. Because, okay, you paralyze half the face on 1 week, and then it generates pain on the other side and doesn't even attack at all the potential symptom or the actual symptom of tinnitus, subjective hearing loss, and vertigo, or jaw locking, and they all kind of come together with the patients. So you're just treating one symptom at a time. Physicians use all kind of different medication, symptom applied. So strike three against the dental profession was that they considered it just a symptomatic relief without looking for what the common denominator is. Well, as I've spoken on many times before, the common denominator is chronic inflammation within the joint, and how chronic inflammation, the mechanism, how chronic inflammation within any joint. Remember, this joint works like any other joint in the body. Hip, knee, elbow, when a joint becomes inflamed, it sends a signal to the brain, says, I'm inflamed. And once it received in the brain says, I'm going to help you out. Don't move that joint. If you don't move the joint, it helps out in the pain. and it sends signals to tighten, to constrict the muscles that move the joint. Tighten that joint, don't move the joint. And that applies to the forearm and tennis elbow. It applies to the temporomandibular joint. And it also applies to other joints in the body because the pathophysiologic autonomic nervous system signals that go back and forth are the same. God did not make a separate set of physiologic mechanisms that operate on one joint and another separate physiologic mechanism that operates on a different joint. They're all the same. So that was a huge misunderstanding when the dental profession just began looking at symptoms and focused on just making symptoms go away. So what do I mean by less is better? Well, I was taught both in my dental training in dental school and my medical training in medical school and my surgical training in oral and maxillofacial surgery. I was always taught that you apply the treatment that is simplest to perform and has the least number of side effects and unintended consequences. Now, I can reel off a whole lot of bad side effects, drug side effects, and unintended consequences of treatment designed to attack symptoms. Now, surgery, I could speak on that, keep you busy for years talking about in the books and my own experience with unintended consequences. We call them problems, side effects. When you do surgery, you can have bleeds, you can have infections, you can have misadventures, hooking up one part to another that isn't correct, or taking out something that shouldn't be removed, or having a slip of the hand. You got to have good hands if you're a surgeon. But those are unintended consequences. And you want to choose a solution for the problem that has the least amount of unintended consequences and complications. And if you can solve the problem using something less than a more complicated problem, you're doing the right thing. Well, as it turns out, my experience, even up to this very moment, that there are sections of the country that engender the idea that TMD should be, because it's a very complicated, quote, I put this in quotes, because it's a complicated disease, you need to treat it in a complicated way. And I just read the invitation just a week ago to a very good dental school that has a symposium scheduled for June 30th. And part of their promotion was to promote how complicated the disease was and the different aspects that they brought into play, different complicated things they could bring into play to try to solve it. To make it complicated does not make it right. In fact, if you think about how things work in your own life, think about it just a little bit. Things that have occurred to you or things that you've done, when it really comes down to a solution to a problem, the solution usually works out to be something very simple. The correct solution that actually solves the problem is usually a very simple concept or treatment or decision rather than something complicated. So doctors, for some reason, have lost their way in trying to make things complicated. Maybe because they can make it complicated. Maybe they deserve a bigger fee, or maybe they're more important because they can make things complicated that the average person can't do. But the point is that complicated is not the right way to look at solving a problem, certainly a surgical medical problem. And in this case, especially the TMD problem, which has been a conundrum mystery for well over 70 years. Another good example in the area of TMD treatment is the doctors, small number, but growing, of doctors who, quote, specialize in TMD treatment and want to make it a very complicated system that they apply because, well, it makes them more important or keeps the competition away. I'm not sure. I really am not sure, but I see it. I can't get into their minds and decide what it is that drives them to want to make something complicated. But the simplicity of this, the simplicity of TMD is that if you damage a joint, in this case, this joint called the temporomandibular joint, if you damage a joint, it creates inflammation trying to heal. Inflammation is the body's response to damage. Inflammation is the body's attempt to heal itself. If it worked all the time, you wouldn't need doctors. And that's a fact. That is a fact. If inflammation was successful 100% of the time, you wouldn't need doctors. However, there is a growing number of TMD gurus, is what I call them, who apply smoke and mirrors, complicated smoke and mirrors, multiple levels of smoke and mirrors, machines, all kinds of different things, multiple different kinds of drugs, and make it as complicated as possible. But if you follow me along, all of the common denominator actually is inflammation in the temporomandibular joint. So if you can figure out a way to decrease inflammation in the joint that is simple, not complicated, then you are doing the right thing. And what I discovered after I discovered that the common denominator of TMD was inflammation, and that inflammation created directly each and every one of those symptoms I mentioned, once you understand that the inflammation is the common denominator, then it was pretty easy to figure out how best to get rid of inflammation other than nonsteroidals or other things that have been available for years and years. But the way you get rid of inflammation is to rest the area. When it comes to joints, the orthopedic surgeons know how to rest a joint. Unless if the damage is so severe, then you have to apply surgical correction of various kinds. But the easiest way, the most successful way to rest a joint is to unload the joint. In an elbow, it would be a sling. Yeah, for a hip, it would be a set of crutches. And for the temporomandibular joint, it would be a device that you put in your mouth that took the load off the jaw joints. 90% of the loads on the jaw joint are from the posterior teeth. So if you unload the posterior teeth, you're taking 90% of the loads off of the temporomandibular joint. At which point, when you do that long enough, according to a well worked out protocol, which is 24/7, wearing it full time, except when you eat for the first 2 months, and then nighttime only the rest of your life, that's pretty simple. You can talk with it in your mouth. You just can't chew with it in your mouth. Quite simple. So if you use this device appropriately, it's not hard to use. You unload the posterior teeth, unloading the temporomandibular joint. Inflammation goes down. Inflammation drives all the symptoms, and guess what happens? All the symptoms go down. They go away. You just have to be consistent, and you have to follow the protocol. So a device, in this case, just like a set of crutches or a sling, is the simplest way to treat TMD, and less is better than complicated when treating the TMD. Hopefully I made my case on this, but it is true. Hopefully you've seen my logic on this. I appreciate your attention, and I look forward to the next time I might have your attention to pick another topic and expand on it, extrapolate a little bit more for full understanding, because I've learned describing this problem and describing the solution, although I've learned to be pretty good at it, it goes over a lot of heads the first time. I don't think it's hard to understand, but I find, and revisiting people after my explanation, that there are a lot of questions as to the misunderstandings that the patients have about what I said. With that message delivered, I invite you to come back next Tuesday Always produce these episodes on a Tuesday. And we'll see what else I have to say about TMD Demystified. I am Tony Urbanek.